Did you know that too much salt restriction can actually worsen heart failure outcomes? That's right. While a low-salt diet is often prescribed as part of heart failure treatment, research suggests that extreme restriction may be counterproductive, especially in cases of heart failure with preserved ejection fraction, a condition accounting for half of all heart failure cases. This form of heart failure occurs when the heart's left ventricle can't fill properly with blood during the diastolic phase, reducing the volume of blood pumped out into the body. So what's the connection with salt intake? Research published in the journal Heart, which utilized secondary analysis of data from over 1,700 people aged 50 and above, set out to explore this. These individuals, all of whom had heart failure with preserved ejection fraction, were part of the TOPCAT trial, a phase 3 randomized double-blind placebo-controlled study designed to test the effectiveness of the drug spironolactone. The participants were asked about their salt usage in cooking staples such as rice, pasta, potatoes, soup, meat, and vegetables. Their responses were scored on a scale of 0 to 3, with 0 indicating no added salt and 3 indicating half a teaspoon or more. Their health was then monitored for an average of 3 years, with a focus on death from cardiovascular disease, hospital admission for heart failure, and aborted cardiac arrest. Interestingly, around half the participants had a cooking salt score of 0. More than half of them were men, and most were of white ethnicity. These individuals weighed significantly more and had a lower diastolic blood pressure than those with a cooking salt score above 0. So what's the takeaway message here? While salt restriction is a common recommendation for heart failure patients, it appears that less is more may not always be the best approach, particularly for younger people and those of Black and other ethnicities who seem to be most at risk. Finding the optimal salt intake balance is crucial. In other words, it's not about completely eliminating salt, but rather about finding that Goldilocks zone of intake. Not too little, not too much, but just right. Remember, everything in moderation, including moderation itself.